everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. So now you are a student, you're a nursing student, correct?
Yes.
Okay, so we have a nursing student, and then you also play tennis, and that is going to lead into what your chief complaint is today, correct? Alright, so it's right-sided neck pain going down into that shoulder, correct? So you're feeling it from in here, kind of even just going all into here, correct? Alright, does it go any lower than the shoulder? No. Okay. And then you're saying also you feel a little bit of pain in that mid-back, but you feel that could be from just slouching too much while as being a student. Okay. So we'll definitely focus on both those two areas today. Well actually, let me get ranges of motion done first, just kind of get a baseline, see where you're at. So I'm going to have you just look up in the air. Any issues with that? Look all the way down to the ground. Any issues there?
It pulls.
Where at?
Right here.
Okay, more on the right side? Okay. If you were to bring your ear to one side and to the other?
It's just tight.
Just tight?
Only when I go that way.
And I'm hearing some self-cracking going on. If you rotate from either side, any issues with that? Okay, good. So I am going to have you sit up nice and straight. I'm going to push down on the top of your head. Any pain with that?
No.
Good. I'm going to turn you to this side. Any pain there?
Yeah.
On the right?
Yeah.
Did it just stay right in through here?
Yeah.
Okay. We're going to turn you to this side. Any pain with that? Good. Alright, we are going to distract and lift up. Any increase in pain, decrease in pain, or no change?
No change.
Okay. So, let's go ahead, just because of that pain pattern with the shoulder, what we're going to do, take this arm, put it on my shoulder. Yep. So we're going to go through, and it's going to be lighter right now in the beginning because I know this is sore for you. So we're just going to go through and we're going to work that entire shoulder out. So I like to work pecs, and as we're going into, we got the deltoid, the anterior, middle, and posterior delt. We're going to work in there. You'll even feel, kind of get the hypervolt into that bicipital groove as well, which can be very tender for some patients. And now this really only comes about more with tennis season, but you're noticing this also currently right now? Okay.
That hurts. Right there.
So alright, just a little bit more. Perfect, relax.
I'm like sweating. That's how bad it hurts.
Alright, I'm going to have you lay face down for me. Alright, so before we get back using the hypervolt, we're going to scan the entire body. We're going to look from that cervical spine, checking the leg length, going all the way down to the feet, and we're going to be checking that symmetry from the right side to the left side, seeing if there's any imbalances in the body here. So when I go to push in while I'm palpating, let me know if there is anything tender to the touch, okay?
Okay.
So we're going to start in at that cervical spine. Any pain in through here?
Right there.
Okay, in here? Okay. So still that right-sided pain in the neck. Starting that cervical spine, now into that thoracic spine. Okay, now coming down into the lumbar spine. In here? Okay. So about L2 area. Alright. Any pain directly over that right side joint?
No.
Any pain directly over the sacrum?
No.
Any pain directly over that left side joint?
No.
Okay, good. We're going to come down here to the leg length. So as you can tell, just a little bit short on that left side. So we're going to focus on that as well. Now when I scan up the body, the one thing that I am noticing is her hip right here is slightly raised like that, is what I'm noticing. So she's favoring her left side here. So those are going to be just some of the spots that we're going to focus on today. But now let's go ahead, we're going to do the hypervolt on your back this time, and we're just going to relax everything. Sound good? Perfect. See, this is probably not as painful as the other side, is it?
Oh, this hurts. Not as bad as the front. but
Okay.
it still hurts.
Okay. Soreness in here or tickle?
Yeah. No, soreness.
Okay. We'll go light. Okay. So let's go ahead and start off with the adjustment. Now I always like to start in that cervical thoracic joint up here. And we're going to start T2 on the left here. Good. We're going to drop down to T3 on the right. There we go. I know you felt how that just took the pressure off the nerves there. Opened everything up. Take a deep breath in and exhale out. Good. One more time. Deep breath in and exhale out. Good.
I love that.
So we're coming down here. Still left, short leg, right there. Okay. How's that spot doing in here?
It's okay. It's not
Not that
that bad.
bad? Okay. Alright, so let's check out the sacrum. So I'm going to stabilize right here, right on top of the sacrum. I want you to raise this leg up as high as you can. Any pain, tenderness, tightness?
Yeah,
Yeah?
right here.
Okay. Now we're going to do the same thing with the left side. Raise that leg up. Alright, so that one went up a lot higher. So I'm going to imagine that was pretty easy, no pain with that at all.
Yeah, that was
Okay. So I'm gonna have you I'm gonna have you cross your right leg over your left leg for me. Good. So the table is gonna come up from below. And there we go. And so what we're gonna be doing, your sacrum, what's happening is it's pointing more towards that left side. So when it points more towards there, as you can tell, that left leg was able to raise up a lot higher where the right one did not want to go up as high. So we're going to do a P to A, which means posterior to anterior adjustment, and we're going to be doing a counterclockwise torque to bring that sacrum back to midline here. One more. Good. Uncross. And we're going to bend this knee. And one more. That wasn't good. One more. There it was. Good. Okay. So I want you to raise that right leg now. Do you notice the difference?
Not really.
Not really? Okay. No?
I still feel like tight right here.
So it's tight right in there. Okay, so she's still noticing that tightness right in that area. So what we're gonna do, I'm gonna have you lay on your side, and I want you to face me. There we go. Okay. Good. I'm gonna have you flip to the other side. Lay flat on your back for me. Alright, so now we're going to do that leg pull. You're going to feel some relief in that ankle, going to the knee, up to the hip. So all you need to do is just relax right here. Good. There we go. You feel that going into the hips with that? Good. I'm going to have you stand up. Hands up and over mine. Good. I'm going to have you lean back onto me. Squeeze your elbows together.
Oh my god.
Good.
Double chin.
Take a seat right here for me. Facing that way.
They go think you won't bet and cry.
Okay. So we first did that prone thoracic, then we just did the standing intercostal. Now we're going to do that anterior or supine thoracic adjustment here. So I want you to take a deep breath in and exhale out. Good. Alrighty, nice and cleared out. So now let's go ahead and we're going to do that Y-strap adjustment. This is where you're going to get that decompression from the cervical spine. Lift your head up, go ahead all the way down. Good.
Oh, I'm nervous.
Don't be nervous.
Oh my god!
Just relax, relax, relax.
Oh my god! I can't breathe.
And relax. Did you feel how that decompressed the spine?
See, that was painful.
Really?
Yes, it hurt.
Give it a minute. It's that initial pull can definitely, you obviously it's not a normal adjustment that you've ever received before. First time, correct? Okay, so first time with getting that Y-strap, I know you're feeling that decompression. Yeah, it's like a shock to the body right away.
You might get sore.
You can. You can get, you can get sore. Granted, that soreness will go away after 24 hours, so that can be normal. We always tell patients that. But once we let you relax a little bit and you'll sit up, you'll notice a difference when we go through and do those ranges of motion again after. So I'm gonna have you sit on up.
Her face is red. She's flushed.
How would you describe that Y-strap?
It hurt. But I did feel the decompression. It was just like a shock. I didn't think it was going to be like that.
You don't know what to expect.
Yeah.
Yeah, it was definitely different.
Mm-hmm.
Okay. Now this time what I want you to do, originally when I had you look up, look down, look around, do all that, like stand up, move around, raise that shoulder up of yours.
Oh, it feels fine. It don't hurt.
What was that again?
I feel fine. It doesn't hurt.
Look up, look down. How's everything feeling? Feeling looser?
Mm-hmm.
A little bit more relaxed? Mm-hmm. So that initial pull, yes, no. It obviously it can hurt. There can be some soreness, but the effects after, as you're sitting here, as you're letting your body kind of calm down, because you know you've got your neurons that are firing now, going crazy because you've never had that pressure being released off those nerves. But as you relax, as time goes by, you're starting to feel better, correct? Yeah. Okay. And I'm not just guiding you into that.
I feel better.
Okay, good. No, but that, I love the different responses from patients, because people who do come into the office, I want you to know that, some people, you can have that initial, like, crap, like, that hurt, and then you realize, and then it's like, okay, wow, it's getting better. Or some people, they get up and they're like, yeah, that was good. Everyone they respond differently. Everyone that does come in, you guys are all real patients. I don't, everyone, they find me, they search me out, and I love just providing a good service for patients. And
you sure she's not an actress? How much do you pay her to come in?
Yes, you're right. Are you another paid actress, I guess? I'm kidding, guys, but yeah, how are you feeling?
I feel good.
Good. Perfect. So if anyone is looking to schedule an appointment, just go right to the website, drjosephcipriano.com. Send me a message. I'd love to get you in here. Have a good one, everybody.